Welcome to Hartford Next Neighborhood Training Institutes. It's our city series number 8, episode number 8. Today we are having a conversation with the Department of Health and Human Services Director, Ebony Jackson-Shaheed. Hartford Next is the coalition of Hartford's 13 NRZs, Neighborhood Revitalization Zones, and the Neighborhood Revitalization Zones came into being in 1995 with the state legislation that brought them to life. The NRZs are here to help the neighbors and the residents of the neighborhoods to improve the quality of life, and Hartford Next serves as a coalition to bring everyone together to have a collective voice to advocate for the concerns that we have within our community and neighborhoods. The Neighborhood Training Institute's purpose is to help to educate, bring information to people, to the residents, and to help us improve what we're doing and work together. So today what I'd like to do is introduce our host. Our host is Frank Sentner. He is one of the chairs of our program committee, as well as a member of the South Downtown NRZ. Frank, thank you.
Thank you, Marion. As Marion said, I'm Frank Sentner. I'm the Vice President of the South Downtown Neighborhood Revitalization Group, SODO NRZ for short. And we're a little gem of a neighborhood, pretty small, bordered by Main Street on the east, Park Street on the south, Washington Street on the west, and Bushnell Park on the north. We're probably best known as being the location for the Bushnell Performing Arts Center. But we have lots of folks in our neighborhood, probably close to 1,000 residents, 1,000 residential units, and plenty of really good restaurants, so we'd love to have you join us sometime. I'm here today speaking with Ebony Jackson-Shaheed, the Director of Health and Human Services for the City of Hartford. Welcome, Ebony.
Thank you. Thank you for having me.
So we'd like to hear, first of all, about you and about your background, where you come from, what got you into public service, how you wound up in Hartford.
Okay, sure. So I am what I call myself a Connecticuteur. I was born and raised in New Haven, Connecticut. I am a 7th generation Connecticut resident. So I've been here, and my family has been here for a long time. So I have family all over Connecticut. We have family in Waterbury, Ansonia, Litchfield County, here in Hartford, and you know, that's where I come from. So born and raised here. I started out my career, I don't know if I would really say public health, but science. I was a teacher. I was a science teacher for a few years. I did middle school, so middle school science. For all the teachers out there, I'm with you. Okay. So I started out in education, and then I think, you know, from education, it just snowballed into more so of my passion. I think most people in public health, I don't know if we really set out to have a career in public health. Some of us start out as either teachers or nurses or emergency management. And so I thought that I was going to be an OBGYN. That was what I thought I was going to do. And then ended up in education, and then ultimately, you know, here as a public health administrator. So I think my passion has always been health science, and that's what ultimately led me to the career that I have today. So that's, you know, how I ended up in public health. I think my love for public service probably started, you know, as a child. I mean, growing up in urban areas. I am the oldest of 7 children, second oldest of 11. So, or is it 12? But, you know, I think I've always been a public servant. And I think that all the roles that I've had in my life, whether it be careers or, home life, prepared me for the position that I'm in right now, because you really have to be like an octopus. You have to be able to do a lot of things and wear a lot of hats. So I think that has, gotten me to where I am.
And how long have you been here in Hartford with the Health and Human Services, or even before that?
I have been here in Hartford for 2 years. So I started here in May of 2023.
Okay.
So I came in at that time and under a transition, and I've been here ever since. And I honestly love Hartford. I mean, I don't really think it's, because I've lived in so many of Connecticut's large cities. I lived in New Haven, I lived in Bridgeport. Coming to Hartford was honestly just like being home. It really doesn't feel any different. I think, the difference with Hartford is you guys do have lots of restaurants. I will say that. But being close to the Capitol and it feeling very historic, I think I enjoy that about being here.
That's great. We love it here. So can you tell us a bit about the Health and Human Services Department? What are the primary responsibilities and your role in that?
Sure. So I'm the Director of Health and Human Services. I think a lot of people don't really know about the history of the Health Department, but the Health Department in Hartford wasn't always Health and Human Services. There was a Department of Public Health and there was a Department of Human Services. And so those two departments kind of fused together, and that's how we get Health and Human Services today. So I am the director of both of those departments, now considered one. And honestly, our mission is to prevent, promote, and protect. And we have your local health department does so much for the city. And I think a lot of people, when they think about public health, most of the time, they probably just think about disease prevention. But believe it or not, that's not our largest role. So while it's, one of the things that we do, environmental health is pretty big. And so that, I always say that, environmental health is our bread and butter, but it's a very large portion of any local health department. But honestly, our primary responsibilities, we do all that, preventing, promoting, and protecting through education. So health education, policy development, program and service implementation. We do lots of environmental health enforcement, and we do disease prevention and surveillance. So the disease prevention and surveillance does kind of go along with our environmental health efforts as well, but they are separate divisions. And we do have 5 divisions at the health department. So we have a maternal child health division, we have our environmental health division, we have administration, we have finance, and we have a senior and community services division as well. So we have lots of initiatives that are coming out of the health department. And, public health is, I don't want to say it's everywhere and it's everything, but it touches on a lot of what we do in our lives. And so the health department is really at the center of a lot of that. And most people don't know how much the health department actually is a part of, their quality of life in their city.
So if you had to choose, what would you say the biggest challenges in public the city of Hartford?
So we have a lot of challenges, right? And I think, I don't want to say it's just for urban cities. I think that overall, there are just a lot of changes that we're undergoing nationwide and worldwide. Climate change is a large thing that we're going through. But I think for the city of Hartford, I would say chronic illness. So we have a lot of chronic illness in the city of Hartford. We have a lot of high blood pressure. We have a lot of heart disease, diabetes. But we also have high rates of poverty. We have high rates of housing displaced individuals. So we're facing, very large challenges. I think that there are a lot of different root causes that are common And there's trends, that you see in maybe some urban areas. But I think that those issues are also not just specific to Hartford, but we're seeing that on a nationwide scale as well.
So since the Health and Human Services Department, touches so many different aspects of our lives, how do you collaborate with the other departments in the city that are focused on quality of life or public safety and so forth?
Oh my goodness, we work with them constantly. I'd like to say my work departments, some people say work husbands or wives, but my work departments, right? They would be the fire department, police department, DDS, Department of Development Services. So our environmental division works very closely with L&I and DDS, that's licensing and inspection. They do our housing code enforcement. So they are really intertwined with, our environmental health division, not just from an environmental sector, but also from a relocation. So we offer, relocation to fire victims and also housing code violations. So we work with that department very closely. And our fire department, our fire chief, which is also our emergency management director for the city, that's hand in hand with the health department. So we work very closely with him, especially when we're talking about cold weather and warm weather protocols. So we work closely with, the fire department, and then obviously our police department when it comes to public safety. So they not only work with us on issues of public safety, but they also work with us for environmental as well. So when we go in to possibly do some enforcement, we're working with our community officers. So I'm fortunate to have very, very good partners, very responsive, and they're very passionate about the work that they do. So I'm fortunate in that respect.
Yeah, sounds like a lot of really big issues and real challenges. Switching to something maybe a little more positive, can you give some examples of health and wellness programs that you've implemented?
Yeah, sure. So we have quite a few health initiatives that I want to just mention. We have our Headspace initiative, which is a wellness initiative for the city of Hartford. It's a mindfulness app that we would love for Hartford residents to download. They get free membership for a year, for up to a year. But it really does, help individuals cope with the stresses in their everyday lives. So we are, very excited about this initiative. We've had it for a little while now, but it's still relatively new. So definitely please check out the Headspace initiative. You can go on 311 or go on the city website to find out more about that information. We also have it on the our Hartford website as well, our health department website. Yeah, so that's one of our largest initiatives, I think, for residents. But we have so many. We have was that for me? Oh, okay. So we have so many that we're working on. So we have our Headspace initiative. We also have our REACH program, which is amazing. We're so fortunate to find out that we are going to continue to be funded. Right now, a lot of state and federal funded programs are undergoing uncertainty right now in these times. And so we were fortunate to find out that our REACH program would continue to be funded. And that program is basically set up to serve individuals and communities that are having issues with nutrition, so food insecurity, and also movement. So we've had a large campaign last year, which was one of our largest campaigns around movement, and we collaborated with community organizations. That was very successful, but that is, one initiative that we're very proud of as well. So, come out to the farmers markets when the weather gets warmer.
Yeah, I love the farmers markets. So, in your senior and community health division, you provide a lot of services, renter's rebate, dial-a-ride, Heart Home Health Program, and you also operate 4 senior centers in the city. Can you tell us a little more about these programs?
We do. So we have 4 senior centers. They are subcontracted out, so there are community organizations that basically operate the senior centers for us. We provide lots of senior-centered activities at these senior centers where they can come out and they can go to the gym, they can engage in activities like bingo. We recently had a collaboration with Yale University that did a study on how movement affects brain activity. And so they use salsa, salsa classes, dance classes. The seniors absolutely loved it. And so that did come to a close, but we're trying to come to some sort of agreement with Yale to continue the program because the seniors were like, we are not having it. We need to have this in our centers. We also offer like computer literacy programs. And one of our largest, I guess, flexes with the senior centers too is that we offer meals. So a lot of times, it's difficult for seniors. They're on a fixed income. And so when they come to the senior centers, they're in a safe location. They're in a location where they can socialize with their peers and also, get meals. So we're really excited about that. And we're trying to improve, on the activities that we actually have available for them. So we're trying to work with, some of our other organizations that have pools so we can have that available to seniors as well. Get some more aerobics classes in there, really get people moving.
Yeah, keeping moving is definitely the most important thing.
Yes,
and I can't imagine anything better than salsa. So, are there any new and upcoming initiatives that you'd like to emphasize for our audience?
Sure. So there are a few. I still want to really just push the headspace because, I think we really can have a boom of improvement in numbers. So we really just want to push headspace. I do want to say that we have a new initiative in our Ryan White Part A program. We were recently funded for the Emergency Relief Grant program, which provides financial assistance to areas with high HIV rates. So basically what that does is it helps us improve access to HIV care and treatment, and it helps to improve some health outcomes. So we're really excited that, we're able to offer that new program for that community.
So I'm pretty involved in the city. In fact, I think one of your senior centers is on Wadsworth Street in our neighborhood. I believe that's Catholic Charities runs that.
Yes.
Yeah. And there's a lot of things you're saying that I'm not aware of.
Oh,
and
really?
yeah. So that, prompts the question, what kind of resident awareness initiatives do you have to sort of push the information out there? Something like Headspace, I'm a real techie.
Yeah,
it sounds like I'd like to get that on my app.
Oh, good.
Yeah.
So I think, just like, many municipalities, when it comes to communications, it's forever evolving, right? I think sometimes we may rely on our go-tos, right? But I think right now what we're doing is a real revamp with communications. So right now what we're doing is a lot of social media pushing. So we have just uploaded our Instagram page. We now have an Instagram page. Before we were just using Facebook. So we're trying to get more social media platforms. We have our 311 system who works very closely with our department. So we have our community and engagement director that we're working with. And just honestly, we're trying to, figure out what the balance is with that, how do people get their information? So that's really important. We definitely want to make sure that we're appealing to all audiences. I think for, a lot of our younger audience, we're seeing a lot of feedback with our social media. We're getting a lot of positive response, but we also want to make sure, like you said, for our seniors and other populations, that they're also getting the information. So, we're trying to do a mix of, taking it old school, pen to paper, flyers, also, social media, and then trying to also put things out there on the news. I think a lot of people, especially our seniors, they go to radio a lot. And then everyone watches the news, right? So we're really trying to get like a calendar so that we can post either, special events that we're doing or even, the World Health Organization or CDC, they have like these monthly activities that we kind of can correlate with, and we can kind of put that information out, and maybe on the news we can put a little wording there for activities, just so that we can broaden our horizon with how we communicate with residents. But we're still, that's always going to be something that we're constantly trying to improve.
Yes, I know in Soto we struggle with that as well. We have good social media and digital outreach, but there's a lot of underserved folks in our neighborhood that we can't reach that way. Do you have any suggestions or strategies to reach folks?
Yeah, sure. I mean, I think some, I guess, unorthodox ways that we've used in the past. I know with our REACH campaign, when we did the Mueve Day campaign, I think what worked well is we not only used English-speaking channels, but we also reached out to Telemundo, some of our newspapers that are in other languages. Also, bus wraps work well too, because they're kind of like just riding around the city, right? And so having your campaign kind of advertise on the buses work well. Also, radio is big. I think multiple radio stations too, work well. But the thing is, with communication, sometimes there are expenses. Communications are very expensive. So I think, that's why sometimes it's hard to reach those areas that are underserved. It's because there's a limit on the way you can actually, like what you can do with your campaign and the amount of funding you have available to you. But I think, trying some of those more unorthodox ways and maybe going into places where people are on foot, barbershops, salons, even faith-based organizations, and advertising in those locations where people feel safe. That might be something that you might want to try as well.
Yeah, it's amazing the number of faith-based organizations we have in the city, and a lot of them have programs. One of the things we're doing in Soto for community outreach is we're engaged with OPP, Our Piece of the Pie.
Oh, I love that.
And getting some of the young people that are engaged with that to work with us on canvassing. And that has a dual purpose, right? It gets the mission, vision into the minds of the young people as well as boots on the street.
Oh, I love that.
Yeah.
Yeah.
So do you have a lot of opportunities for community feedback? I know you mentioned 311, and I use the app a lot.
Okay.
And I think a lot of people view that only as I see a problem, a pothole, bulky waste, that sort of thing. Are there other ways that people can provide feedback?
Yeah, so on our website, we do have a space where people can, provide feedback to the health department. Also, we do a community health needs assessment, and that's something that every health department is required to do. And so we don't, a part of that community health needs assessment is actually reaching out to the community. So we do reach out to community organizations, also residents, right? We do focus groups. So there are a lot of different ways that we actually engage with residents and community for feedback. And we actually use those comments and the feedback that we get. We do use that in program implementation and policy development. I think that is important because it needs to be tailored to what the community is seeing at the time. So we're really vigilant in that area.
Yeah, I think like many cities and other places, we have some serious mental health challenges and substance abuse challenges in the city. Are there specific programs that your department has implemented to address those?
Honestly, I was really surprised when I came to Hartford with the amount of ways or innovative ways that they introduce social workers. And so we don't have specific programs that do case management, but So just an example, in our relocation program, you know, relocation when people are going through a fire, it's a very traumatic situation. But there are social workers that are relocation specialists. So right then and there, I mean, they're doing the work, right? Dealing with people who, you know, may be dealing with some sort of mental distress, you know, at a time that is very traumatic. So we do have relocation social workers. We do have a social worker in community court. So there's a social worker dealing directly with residents that may be, you know, dealing with the system a bit and helping with lessening the risk of recidivism. So we have a social worker embedded there. And then we have our community health workers, you know, that are working and talking with community members. And connecting them to resources. So really, you know, if someone has an issue, connecting them to, you know, an organization that specializes in mental health services is very, very important. So we do have our community health workers that do that work. And we also have our MIOP program, which is a maternal infant outreach program where we have home visitors. And so those outreach specialists are inside of residents' homes, and they're helping, you know, new mothers and families building connections with their children and bonds and actually going through a whole curriculum. But that is really a time too when if you see something, say something, where we can connect to services. So there are many ways, you know, in a lot of our programming where we are constantly connecting people to services and do have people on staff that can help with individuals that have mental, you know, are going through mental health issues. But we also have, for our substance abuse, we do have the OD2A grant, which is an opioid grant. And we are working with 14 other municipalities in the region with basically standardizing certain practices, right? The way we deal with opioids, the opioid crisis may not be the same way that our northern or central health districts deal with it, right? So we're coming together to come up with weight communication standards and also, you know, data sharing capabilities with our other partners. So, I mean, we have some really good initiatives that we're running at the health department, and I think that when it comes to people, we do prioritize individuals with mental illness, you know, out of COVID, right? We were dealing with COVID, which was a public health emergency at the time, but there are some epidemics that came out of that, right? And so our mental health really is a priority for most local health departments.
Yes, in our last episode of It's Our City with the fire chief and the director of emergency services and telecommunication, they specifically mentioned an organization called HEART.
Oh, yes.
Yes, which is often dispatched to address mental health related issues that are police calls because you know, it's difficult for police officers to deal with those sorts of situations. We also had a young lady there who was part of a nonprofit, I don't remember the name of it, that did work specifically with folks that are displaced by fires. Okay. They have a van, they show up when there's a fire, and they, you know, help the families with food, clothing if they need it, and resettlement. And so there's so many organizations in this city, as well as all the city services. And I really wish that we could all get on the same page and know about one another and what we're doing and collaborate, you know. Every time we do one of these, I learn more things about the city, both the city services directly and the other kinds of nonprofits that are operating here. It's really, really incredible. You mentioned having meals at the senior centers. Are there other programs for non-seniors that address food insecurity? Because we definitely have a problem with that.
So we do have a lot of organizations in the city that are working on food insecurity. I know one organization that we're working with is the CADIF, and that is a Community Action Task Force. And they are diligently working on making sure that residents, specifically in the North End, you know, are able to have access to healthy food options. So we're working with that organization. There is a new grocery store that opened up that they basically work on a sliding scale for residents, so that's really important. So there are a lot of initiatives, I think, in the city that are working towards food insecurity. And I think it's important for people to learn more about what food insecurity is and how it's not only, or not only one population is affected by it, but a very high percentage of Americans are affected by food insecurity at one point in their lifetime. And so I think that's really important to understand too, how food insecurity works. What exactly does that mean? I think people look at Hartford and they say there's food everywhere. There's bodegas. There's, smaller grocery stores. What do you mean that there's, that people don't have access to healthy food? But see, that's it. It's healthy food options to actually nourish and heal the body. And so a lot of times when you have lots of food spots around the city, they may not have access to the healthiest options, right? Or they may be very limited. So you may get fruit options or produce options. You may get some onions, right? You may get some plantains and maybe some apples or oranges. They sell bananas at gas stations too. But I think that variety is not enough to maintain a healthy balance, for a good quality of life. And so that's really what food, insecurity is not having that access to a well-balanced diet. So really important stuff. But there is a lot of work. We also have a food policy committee where we work with a couple of organizations and, to try to, create some better policies when it comes to food access around the city. And don't forget, like, a lot of our smaller organizations are also, there's a lot of farmers markets that are available in the city, so people really should take advantage of those. We really want to see, a lot of support, because there are a lot of organizations, doing good work, but we want to make sure that people take advantage of those opportunities as well.
Yeah, I don't think everybody is aware. Some people tend to think of farmers markets as sort of an upscale thing. And I've shopped there, and the food's not inexpensive. It's really good. But they also take SNAP.
They do.
And I think people don't know that, and therefore don't take advantage of that opportunity, which may be right in their neighborhood.
You know what? They take SNAP, and also a lot of people are not aware of the benefits of WIC. So WIC is not just for pregnant women.
Yeah.
WIC is also for children up to the age of 5 years old. So if you have a child that is 5 and under, you can be getting WIC benefits. And WIC benefits, with those vouchers, you can get fruits and vegetables. So I think, when people think of certain programs, they're like, oh, SNAP or, WIC, what can I really get with WIC? Is it just milk and cheese and bread? Like, no, it's grains, you can get produce, you can get, your fruits, your veggies. I mean, there are lots of benefits from what we're offering.
And it's a matter of communication and education.
Absolutely.
Just letting
absolutely.
people know. So you arrived after COVID here in Hartford, right?
Yes.
And maybe dodged a bullet there. I don't know what you were doing before, but what type of preparations do we have for the next pandemic?
So I was in Bridgeport actually during the pandemic. So I was the health director there. So I was actually I was working very closely with the previous health director here in Hartford. A lot of the larger cities, really band together because we were going through similar issues. So that's where I was during COVID. But after COVID, I think we have an amazing epidemiology department. A lot of people don't know that, but many local health departments do have epi divisions or some way of constant disease surveillance. So I don't want to toot our horn, but
Please, toot it.
We're always on the lookout, and we are working very closely. We have very good communication with the Connecticut Department of Public Health, they are always vigilant. They are always, giving us information on any diseases, current diseases or diseases, that they may see as a threat, to our quality of life. So in terms of that front, I think that we would have more information on how to deal with a next pandemic if we had to, because we went through COVID. So I think that what COVID showed us is that we are resilient, right? We do know how to work with each other in the end, especially because you're forced to, and that we can be adaptable. Like, we can actually do things, in different ways and still have similar outcomes. So I think, if we had to, rate where we are for the next pandemic, I don't want to say that there's one coming. I'd say maybe a 7.
Well, that's pretty good.
Yeah.
I know some communities in the U.S. anyway are doing wastewater testing to try to pick up on the spread of viruses and other illnesses before they become apparent in the emergency rooms. Do we have a program like that?
So we do have capability to monitor wastewater. That's something that most local health departments have. We have a good relationship also with MDC. So I think that when it comes to wastewater monitoring, we really don't utilize that as much. We usually, when it comes to disease surveillance, we usually are just looking at hospitalizations. We have, communications with, hospital epidemiologists. We work a lot with other groups in Connecticut when we're talking about disease surveillance. I think the times that we may use wastewater is something like if we're in the middle of a pandemic, right? Or if there is some sort of we're on the brink of an outbreak, right? So that is when, monitoring wastewater is probably mostly used, but we do have the capabilities to do that.
That's great. So now that we've delved into the really deep parts of this, what are your top priorities? Let's look at the future. What are the top priorities for your department going forward?
Oh, I have them written down, so let me make sure.
That's great.
Let me make sure that I get them all. So we do have a few. We want to, within the next year, we want to gain accreditation. So that's what we are doing now. Not many departments in the state of Connecticut are accredited. I actually had the honor of being a part of getting the Department of Health in Bridgeport accredited, along with some other health directors that were working on that. So we were able to accomplish that, and I'm looking forward to getting a Hartford Health Department accredited as well. And so I have an amazing team that I'm working with. So we want to get accredited and we want to maintain the accreditation. We also want to improve our research capabilities. So right now we do have a team of epidemiologists at the health department, but we really want to do more community-based research. I think that we have the capacity to do so. We have amazing universities here in the city of Hartford, and so we are starting to do more collaborations and connections with them on that. I think COVID kind of severed a lot of what we were doing because that was the priority. And I think right now we're trying to reconnect with a lot of programs that were initiated previously, and we want to go ahead and continue that. So we want to improve research capabilities. We also want to increase our disease prevention services. So right now we do have a disease prevention clinic. We're doing STI and TB services, but we have the capability to do so much more. So we want to do, some travel vaccinations. We also, want to provide some clinics for, children, like back to school clinics. I think that those are some of the things from the community that we're hearing that are needs. And so, we're going to be collaborating with some organizations moving forward to try to make those happen and lessen the burden on parents who may be underinsured, right, or not insured at all. And, where would they, be able, to get a physical for their child, right, for school. So these are some of the, the clinics and services that we're hoping, to have available to the community. So we have some things in the works that we're trying to improve on, but I'm really excited about them.
When I go to the downtown branch of the library, I often see the Hartford Hospital, van. It's not a van, it's big. It's almost like a mobile home, which is a mobile health service. Does your department have any kind of mobile, community roving, vehicle that could bring these health services and all the kinds of programs that you want people to be aware of to different communities?
We do have a public health mobile clinic.
Oh, great.
So we just received our mobile clinic a few months ago. Very, very excited. It is like a little 2-room cabin. We have our patient room, and then we have like an assessment area. Right now, we use the mobile clinic for any type of STI testing and health education. So if we're, at events, then we'll, bring out the van, and, well, it's more like a truck. And we'll bring it out for those purposes. But we definitely are hoping, and now that the mobile van or the mobile clinic is licensed, that we can do more activities with it. And so we're planning on doing that. So you'll see us a little bit more.
So in terms of your epidemiologists and research, do you have labs that, it can't be in City Hall, right?
So no. We do have spaces within the health department. So our department is not in City Hall.
Okay.
Our department is in the Bergdorf building in the north end.
Okay.
We are on 131 Coventry Street. So the health department has been there for over 25 years. We are supposed to be moving to a new location, but we have our clinic in that building. We have, our entire division is in that building, right? But we do have a separate clinic, and I think, people should come on out and visit us if they need anything.
In the category of things that I learn every single time, I didn't know you were up there.
Oh, yes. We've been in that area. We're right across the street from the North End Senior Center.
Great. So how can we support you? Hartford Next is the umbrella organization for, as Marion said, the 13 neighborhood revitalization zones. In terms of quality of life, I think everything that you're doing fits solidly within what our mission is. Could we arrange, we would love to have you come to our NRZ meetings, someone from your department, and just talk a little bit about the programs you're describing. We don't get a huge turnout, but that can start the communication in the community, at least if people who are involved understand and know about what you're doing. That can spread. Word of mouth is still pretty powerful.
Yeah, absolutely. We would love to, be in that partnership. We are a part of multiple committees. We're, sitting on multiple boards. So definitely we would love to come out and speak on the initiatives that we're doing at the health department. I think also how people can support us too is just support a lot of the events that we're doing. I think that, depending on the campaign and the communications campaign will depend on our turnout. But I think we would love for the community to just come out and support, in any way you can. We also, don't mind people volunteering. Like that's still, that's really, we look for volunteers. There are plenty of community events where we need volunteers. So definitely reach out to the community engagement office and just get involved. There's always room for volunteers, come our way.
Yeah, we're all looking for those volunteers. So I know that Hartford Next will get you a list of the days and times. They're recurring meetings monthly.
Okay.
Usually not in the summer, but else the other parts of the year, yes.
Okay.
And that way, you know, and speaking for Soto, we would like to invite you to come to our meeting, which is the third Wednesday of every month.
Okay.
We meet at the church building next to the church, the First Presbyterian Church at 136 Capitol Avenue, 6 o'clock. It's usually an hour, at most an hour and a half meeting.
Okay.
And we do also offer virtual, and many of our NRZs are switching to hybrid meetings so that folks can attend. And, you know, we would love to hear more about the programs that you're offering.
Oh, definitely. Okay, we will make that happen.
I want to thank you very much for joining us. This has been a real pleasure and a learning experience for me. And with that, I think I'll turn it over to Marion to give us our close. Thank you.
Thank you.
Well, I'd like to thank Director Ebony Jackson-Shaheed. This has been very informative for me as well, and I hope so for you as in the audience. I will invite Director Ebony to send to us, Hartford Next, any of the events that you are sponsoring, and we can help spread the word. And again, we would invite you to come to one of our Hartford Next meetings and also perhaps one of our NRZ leaders meetings where you can meet everyone at once instead of having to do everything multiple times. So with this, if you want more information on the Health and Human Services, there should be information for those of you who are viewing online. And if you are interested, we can also send you information. But you have the address, 131 Coventry Street. You've been invited to visit and volunteer. So hopefully you'll take the director up on that. If you are not a member of your NRZ and you are interested in joining others in your neighborhood, please join, take a look at our website, hartfordnext.org, and you can find your NRZ, and you can look, if you don't know what it is, you can look at a map and figure out where you live and which NRZ you belong to. But you can go to any NRZ meeting just to get a sense of what's going on across the city. If you'd like to join our mailing list, you can come to our website, and there's a place for you to sign up for our newsletter where we will be sharing information that's of use to you, perhaps. And please join us for our next event in the series. That would be on March 1st, and it's called Follow the Money, where we will have the Director of Finance and the Director for the Office of Management and Budget to talk about where's our money going. So thank you very much for joining us today. And I'd like to thank our funders, the Hartford Foundation, and LISC, which is the Local Initiative Support Corporation, and the Program Committee, and last but not least, Light Source Productions. Thank you very much for joining us, and join us again in the future.